Good afternoon, everyone. Thank you all so much for being here. And thank you, Mr. Mayor, Mrs. Kennedy, and Dr. Graham for joining us today. So when I started this job 20 years ago this week, I didn't need these. But I do today. So I hope you'll indulge me. So, and also through the whole 20 years, when people ask me at a party, oh, tell me about the work of the Center for Community Health Improvement, I'm always challenged to do that in a soundbite or an elevator speech. So I'm going to spare you that attempt today, and instead try to give you a snapshot of CCHI over the past 20 years by sharing one number for each of our 5 key priorities. So, first, 5,000 Boston, Chelsea, and Revere public school children have had opportunities here with Mass General to be exposed to science, technology, engineering, and math. Whether it's our partnerships with the Boys and Girls Club of Boston, our paid internships and summer jobs, or our college scholarships and social, emotional, and academic support. Next number. 9,000 victims of violence have been assisted at this hospital, either through our domestic violence program, Haven, as part of our social service department, through our violence intervention advocacy program in our emergency department, or the police action counseling team, a partnership between MGH Chelsea and the Chelsea Police for child witnesses to violence. Third number, really like this number, it's a big one. So over the past 6 years, Chelsea public school children in grades pre-K through 4 have engaged in 300,000 additional minutes of physical activity due to their partnership with our Healthy Chelsea Coalition. Next number. Since 2010, 229 people who overdosed on opioids have been saved by the Revere Fire Department, the first fire department in the nation to carry naloxone or Narcan, which reverses opioid overdoses. And this is thanks to a partnership with the Mass Department of Public Health and our Revere Cares Coalition. And finally, since 2001, 16,000 vulnerable patients have been navigated to cancer screening and care by a culturally competent team who works with the patient to figure out what is keeping you from doing this and let me help you overcome it to get this potentially life-saving care. So, needless to say, we have not done all of this alone, and this is just a quick snapshot. So, first of all, we do everything in partnership with the local communities. This would not have been possible without the commitment and leadership of Dr. Peter Slavin, as Joe said. When people from around the country, my colleagues from around the country say, how do you do all this at Mass General? See, nothing replaces committed leadership. We also have incredible board support, thanks to our board co-chairs of Community Health, Colette Phillips, and a very special thanks to Patty Ribicoff, who's not only the board co-chair, but has taken it upon herself to chair the first development campaign for the Center for Community Health Improvement. Thank you, Patty. Yeah. Thank you to Katrina Armstrong, who bravely agreed to be the very first chair of the newly created Executive Committee on Community Health. Matt Fishman, Vice President for Community Health at Partners, has been a friend and supporter the entire 20 years. And more recently, we are fortunate to have Joy Rosen, Vice President here for Behavioral Health at MGH, as mentor and friend. Thank you to an incredible staff. Particular shout out to Kitty Bowman, Director of Revere Cares, retiring after 18 years. Thank you to our amazing health center leaders, whom I would like to name, but don't have time because I'm already getting flashed here. I'm so grateful to have Joe Betancourt as a colleague, partner, and friend for these past 10 plus years. And last but by no means least on this list is, while it took a village to organize this event, a special thank you to Nessa Reagan, Alice Myers, Susan Lady, Aswita Tamagori, Andrea Madu, and Adriana Lopera. Give them a big applause. So how do we decide what issues to work on? We partner with communities to conduct comprehensive community health needs assessments. In our last assessment, Chelsea, Revere, and Charlestown all identified substance use, particularly the heroin and opioid epidemics, as their top priority. And by the way, we are starting to do this work in East Boston as well through a partnership with the East Boston Neighborhood Health Center, and they too identify that as their leading issue. So at CCHI, we redoubled our community-based prevention and early intervention efforts. But it didn't stop there. The entire hospital took notice. As a result, a comprehensive new initiative on substance use disorders is the leading clinical priority of the entire hospital's strategic plan. This is a big deal for a community to have such an influence on the agenda of a major academic medical center. This initiative is a collaborative: medicine, psychiatry, the emergency department, nursing, social work, community health, and many others. The goal is to approach addiction like any other treatable chronic condition, like hypertension or diabetes, while working to alleviate the shame and stigma that often prevents sufferers from seeking the care and treatment they need. So the initiative spans from the bedside to the community. But today we're going to focus on a key part of this initiative, which are recovery coaches. Recovery coaches are peers in recovery themselves who assist patients with whatever change they are ready to make in their lives at that point, whether it's finding housing, dealing with a court issue, or seeking recovery support. I would like to introduce to you one of those recovery coaches, Nicole Bourgeois. Nicole is a lifelong Charlestown resident and patient of NGH Charlestown. She has graciously agreed to share her story of addiction and recovery with us to illustrate the life-saving importance of this new initiative. Thank you.